Hi, welcome to the video on how to refer your patient to the Riverdale Health Center for inpatient rehabilitation programming. The purpose of this video is to provide information on the Riverdale Health Center and provide you with information on how to refer patients to the facility for dedicated inpatient rehabilitation. The Riverdale Health Center is located in Rivers, Manitoba. This is approximately 30 minutes northwest from Brandon, Manitoba. The Riverdale Health Center is a 13-bed inpatient rehabilitation unit. On site, there is physiotherapy and occupational therapy. There are rehabilitation aides on site 7 days per week. Speech language pathology services are available as needed. Please note that OT, physio, and SLP services can vary based on vacancies or paid time off. An inpatient rehabilitation program is appropriate for adults who have had significant injury and/or they require rehabilitation and time to recover. This may be patients who have had a recent cerebrovascular accident, orthopedic surgery, polytrauma with orthopedic impact, spinal cord injury, acquired brain injury, or another type of impact in which a person's mobility or functional abilities need time to rehabilitate and recover. Patients who are admitted here are expected to be active participants in their rehabilitative recovery. Goals are set and evaluated to determine the progress being made. If discharge planning is relatively straightforward for the patient, it may occur while that patient is staying in the Riverdale Health Center. If a patient has completed their course of inpatient rehabilitation and there are ongoing discharge planning factors, the patient may be transferred back to an acute care site in or near their home community. Transfer of care information will be sent. Eligibility criteria for admission to the Riverdale Health Center is as follows. The patient has the cognitive ability and motivation to follow directions that further their rehabilitation goals. The patient is medically stable. No physician or lab is on site after hours or on weekends and holidays. There are limited lab resources day to day. Occupational therapy and physiotherapy on site at the sending facility have been consulted, and there is team consensus surrounding referral to the program. The patient has potential to make measurable gains or physical or functional gains in an inpatient rehabilitation setting. Please note that any weight-bearing status for a patient will be accepted. However, the patient must be likely to make measurable physical or functional gains at that weight-bearing level. Pending high referral rates to the program, referrals with an orthopedic component will be prioritized more highly than other referral types. Referral to the program is complete with no outstanding information. Decision-making occurs as part of an interdisciplinary team. Referrals can be sent from community residing clients. However, a case must be made as to why the patient requires care in an inpatient setting versus receiving care from a community-based option. If you are referring from within Prairie Mountain Health, please refer to PPG 02160, Referral and Admission to the Riverdale Health Center Rehabilitation Program. This can be located on the intranet. For sites referring from outside of Prairie Mountain Health, you are welcome to contact the site by calling 204-382-5321 to request referral information. The site requires full completion of the Riverdale Health Center Rehabilitation Program referral form. This site also requires associated documents listed on the bottom of this form to be sent. The Manitoba Information Transfer Referral Form, recent documentation from therapy services, the last 3 days of integrated progress note documentation, and a current list of medications. Without all completed and accompanying information, the program cannot determine eligibility for the patient, and the patient is likely to be denied admission. Please ensure you are including the patient in care planning. They have to be actively willing to participate in their recovery. Please provide them with a patient and family information brochure so they can learn more about the program and ensure they are coming prepared with their appropriate belongings. The program will notify the sending site of admission to the program through a phone call. If the patient is determined not to be eligible for care, the program will notify the sending site by sending a notification of inability to admit, along with related justification. Thank you for taking the time to watch this video on how to refer to the Riverdale Health Center Rehabilitation Program. By ensuring you are knowledgeable about the process for referral, about the program, and are sending all the requested information, you are helping your patient in their successful recovery. If you have any further questions about the program, please contact the site by calling 204-382-5321.